Hello. All right, so let's walk through Madison's case in a little bit more detail. What I want to do is not just give you a glimpse or an overview or a highlight. I want you to be able to kind of see Madison's journey from beginning to end in a way that allows you to put it together, dissect it, and if you spend enough time on this, you can really see exactly what I did from the brackets that I chose, where I placed them. The timeline is present, so you can see how long I spent in each wire. And that's the purpose, right? If you study enough of these cases, even over the course of 2 to 3 minutes, you're going to be able to get a sense of exactly how you can manage these cases. Now, of course, in our courses, we deep dive into these cases. We spend about 15 to 20 minutes breaking them apart and really giving you the thought process behind it. But at the same time, I want to make sure that we show how we highlight these products, how the Damon Ultima system can truly give us wonderful control with very little to no archwire bending, and how we can use our protocols to break these cases into 3 specific phases that make sense. So hopefully you enjoy. All right, we're going to take one last look at Madison, and this is going to be a little bit more comprehensive. Madison we've shown in the last few posts just to kind of give you an idea, but let's kind of go through Madison and kind of talk about her comprehensive aesthetic diagnosis first. Again, she's got a fair amount of crowding. You figure about 8 millimeters in the upper, 9 millimeters on the lower. The X-rays show a tiny bit of class 2 on the right and a little bit of insignificance with a little bit of protrusion in the upper incisor. So problem list is, definitely a class 1 crowded. We know that we're going to have to resolve crowding and control torque, and that's the most important thing in this case. So when we look at the variable torque selection, because we want to prevent proclination, we're going to make sure that we use retrocline brackets in the upper and lower. You can see that obviously this case is beautifully treated, but let's kind of dig into it just a little bit. When we went ahead and we put on the braces, we started with some round wires and ended up with the first Ultima wire. It took about 8 months to get the teeth leveled, aligned, and derotated. Phase 2 is always about 12 weeks of 180275 to fully couple the system. We start uprighting and getting axial dialed in, and then the remainder of the treatment, we used a little bit of an overdrive wire to really express some torque and get those interincisal angles exactly where we want them. Very efficient, very clean, and more importantly, just simple and very, very kind to the patient biology. You can see here that the x-rays look good. We'll refer out for wisdom teeth later. If we do kind of a comparison, all of our objectives were met. Everything looks really dialed in from a standpoint of cephalometric numbers. Width is great, and lower buccal uprighting is exactly what we expect. So when we look at the arch form progressively increasing, you can see that we're not overexpanding these arches. They're just very, very nice natural arch forms. We're using light force to help the biology wake up the tongue and the cheeks. And you can see her smile just dialing in over the course of 14 months. Beautifully treated case. It was really, really straightforward. And really, when you look at, we've resolved, anywhere between 7 to 10 millimeters of crowding. It turned out beautiful. And again, emphasis on the fact that there's no archwire bending, which makes this case just clean and simple. Hopefully you enjoyed that, and keep checking us out for more.